Welcome back to the Nutrition Made Simple podcast, powered by Healthy Steps Nutrition. At Healthy Steps Nutrition, we believe something as fundamental as nutrition shouldn't be complicated, which is why we focus on a simple, habit-based approach. We know that helping you become the best and healthiest version of yourself isn't just about what you eat or going to the gym a few hours a week. We focus on a holistic framework addressing stress management, mindset, lifestyle, sleep, support system, and of course, exercise and nutrition. My name is Nicole Aucoin, and I'm one of the dietitians and the founder of Healthy Steps Nutrition, CrossFit HSN, and HSN Mentoring. I'm also the author of the Healthy Kids Cookbook, 100% kid-approved recipes the entire family will love. You can find it on Amazon. In this podcast, I'm going to teach you how to take one step at a time to making health a way of life. So excited to be in this series, Understanding Blood Sugar, and today we are in part 2 of this series where we're going to be taking a deeper dive into continuous glucose monitoring. This topic has gotten more popular over the past few years, and I think it's important for people to understand why you might want to do this, even if you are not diabetic, how it might help you understand what's going on the inside of your body a little bit better, and some practical tips that we have seen in our coaching experience with clients that have done our continuous glucose monitoring program. Today's podcast guest is Brittany Wharton. She is one of our registered dietitians. She is also a CrossFit trainer and a pro water skier. She works with a lot of our clients on this program in particular around continuous glucose monitoring, as well as our performance athletes. She's an incredible person, so passionate about helping people take control of their health. So I hope you enjoy this podcast episode. If you are interested in doing continuous glucose monitoring, understanding what's going on the inside of your body paired with nutrition coaching, click the link in the show notes and apply for nutrition coaching today. All right, enjoy this podcast episode. Brittany, welcome back to the Nutrition Made Simple podcast. So excited to chat with you today.
I am super excited as well. Thanks for having me on, Nicole.
So we are on part 2 of this blood sugar management, diabetes, just education series, which is, we're going to take an interesting turn today because we're going to really focus on continuous glucose monitoring, what that is, why it's important, why people need to understand what's going on the inside of their body. I mean, I think we should start big picture. Diabetes management has changed a lot over the years, right? Like I remember going to school and we had to prick our finger, and I'm not going to lie, that kind of hurt. Prick our finger every single time we wanted to check. And I think that created roadblocks for people with diabetes because they didn't want to check their fingers all the time, and they didn't really track their blood sugar as close as they needed to. Now with continuous glucose monitoring, it basically is like a tiny thing that goes in your body, and you can see in real time exactly what's going on the inside of your body. How do you explain? I mean, you're a dietitian in a hospital. You also do private practice too, working as one of our dietitians. How do you explain continuous glucose monitoring for people with diabetes and just people maybe without diabetes? Why would they want to pay attention to this?
Yeah, so just like you said, the continuous glucose monitor is super simple to use. Even for people that are quote unquote scared to use needles, the CGM is super simple. You put it on the back of your arm. You could put it onto your hip. Typically, people put it onto the back of your arm. It's just a quick 1, 2, 3 punch, and it literally feels like someone pinched you. It is so painless, and it's there. It's stuck on you for about 10 days. And it's just a little fiber that goes into your body and is able to start reading your blood sugar. Like Nicole said, we used to have to, and a lot of people with diabetes and blood sugar issues, they still have to prick their finger to figure out, I'm not feeling very good. Let me check my blood sugar. And then they're able to get the result. Whereas the CGM is a very quick feedback of, I scan the CGM monitor with my phone or a different device, and it tells me my blood sugar is X, Y, and Z. So it's very simple to use. It's very user friendly.
Yeah. And even with the one, so we partnered with a company called Signos, and you don't even have to scan your phone. It just automatically Bluetooths and goes to your app, which is really, really great. I think there's a lot of different companies out there right now that have done CGMs. There's the two main ones for diabetic patients that a lot of times your insurance will actually cover now CGM, continuous glucose monitoring for patients with diabetes, which I strongly encourage. If you have diabetes, ask your doctor to get this, because it is so much easier to understand what's going on the inside of your body. Because the truth is, unless your blood sugar is super high or super low, you're probably going to be out of range more than you realize, because you can't feel it unless it's like really out of range. So continuous glucose monitoring for diabetics, great. It's been used more recently. I mean, I think I worked in the hospital in 2012, and it was like starting to be used around there. Now 10, 11
Mm-hmm.
years later, it's definitely more prevalent. But some people with diabetes do not have it. Again, if you have diabetes, go talk to your doctor. Strongly encourage. But what has been happening that's super interesting recently is there's a few companies that have come out and have these devices that are available for non-diabetics. So for people that just want to know what's going on the inside of their body. About 3 years ago, Jason and I, my husband and I, started testing out a few different companies, because people reached out to us and they're like, hey, we've got
Yep.
this company, we want you to try it out. And I'm like, awesome. This is going to be a great experiment for us to see. And the problem was, none of these companies had individual coaching after, like, to pair with the CGM. So yes, you would have the numbers going on in real time, but you didn't understand why your blood sugar was spiking, how to fix it, what was exactly causing it. And it left you in this confusion. I remember one company that I actually really liked the platform, but they didn't have a professional dashboard. So like a nutrition coach that you were working with couldn't see in real time. They gave the foods all a number, right? Like basically A to F, but it was like 1 to 10. One was the worst, meaning like your blood sugar spiked up the highest, stayed the highest, the longest. And then 10 was like, hey, your blood sugar didn't really do anything from this food. Now, we know that your blood sugar going up is a normal part of eating. That's fine. It's just, how long does it stay up? How high does it stay up? And if it stays up too long, that's where complications start happening, right? So when Signos reached out to me, and said, hey, we're creating this professional dashboard where you as a dietitian can see in real time what's going on with your clients. I was like, okay, this is a piece of the puzzle that we need to add. And of course, you're the first dietitian I reached out to, because you're in the hospital, you're in it with that setting. And I would venture to say, and maybe you can correct me if you're seeing something different, but diabetes management in the hospital was the single most frustrating thing that I had to deal with as a dietitian in the hospital. The single most. If you take all the broken systems out there in the hospital, diabetes management is the worst.
Yes, it's definitely the worst, and to so many different points. Unfortunately, first of all, your blood sugar is affected by the food you eat. They don't really have, we don't have the capacity to educate every single patient with diabetes, first and foremost. So even educating them from a food perspective is a task in and of itself. And then you also have the medications. Different medications make your blood sugar go up. Even if they don't have diabetes. I had a patient recently that said, I've never even been told I have diabetes. Now they're having to be on insulin to manage their diabetes. And then, we have patients that they're coming in very sick. They have surgeries. Being sick, being under a lot of inflammation can cause your blood sugar to go up. And then for whatever reason, they're dosing the insulin backwards to someone with diabetes outside of the hospital. They actually give insulin before they eat, which is backwards there, because whenever you do have diabetes, you eat, you check your blood sugar, and then you dose your insulin to help that blood sugar come down. So there's a lot of confusion and a lot of difficulty in that management, because it's backwards, it's upside down, and people leave and they're thinking, well, I didn't even come in here because of my blood sugar. And now they're having to leave, go talk to their PCP. They're getting consults with the endocrinologist to figure out how to further manage their diabetes. And then outpatient dietitians like ourselves are helping to start cleaning up the pieces of what has happened due to sickness and other things of that nature. So there's definitely a break in the system. And I think that's really where we come in with the Signos platform and the CGM, because if you have a history of diabetes in your family, and Nicole is going to touch on this with some stats, if you have diabetes in your family, this is a perfect way to figure out how to not only manage it, but get ahead of it, prevent further risk, and really understand your body so that you don't fall into that broken system later down the road. And it's a really cost-effective way to reduce medical costs, reduce all of those medical bills in the future. So yeah, the CDM is a game changer, honestly, not only in the nutrition department, but that metabolic systems department as well.
Yeah, I think one of the things that was really frustrating being in the hospital was how we helped people manage diabetes. And it basically, we know that different foods will spike up your blood sugar in a different way. For instance, if you have a juice or 4 juices, that's 60 grams of carbs versus having some vegetables and having a piece of fruit that has fiber in it, it's going to spike up your blood sugar differently. But the way you manage, at least in the hospital system I was in, is here you can have 60 grams of carbs, whatever you want for that meal, 60 grams of carbs, eat whatever you want. And of course, sometimes people don't understand that your blood sugar is going to spike up differently, faster, higher when you have things that are higher in sugar. It's just this revolving terrible door. And the thing that broke my heart the most is like people just truly didn't understand that actually taking the time to learn about your body and how your body reacts to food. If you would have done that earlier in the game, you would have prevented yourself so much headaches and just issues down the road. I mean, people are, when you don't control your blood sugar, you're on dialysis because eventually you're going to have kidney disease, or you get an infection
Mm-hmm.
because you can't feel your feet. And then you start having amputations. I remember one guy in the 4-year time span that I was at the hospital, a toe was cut off, then his foot, then his knee, then it was like above the knee amputation. And it ended up by the time I was leaving, both legs. And it all stemmed from the diabetes that was not under control. He was a part of the revolving door system. And I truly believe if people understood how their body responded to food and simple tricks to help you get your blood sugar under control, you would save so much energy later down the line. Like what you're doing today is going to affect your health 10 years from now. Maybe it's not going to affect your health today or tomorrow, but it will catch up to you at some point. So this continuous glucose monitoring project that we've done, it's been really fun to help people that historically weren't able to get this information, right? Because the way it works with diabetes, it's like, you're fine until your number hits this point, and then it's like, okay, now you're on medication. Versus, hey, we're getting closer to this line, and now let's go backwards and start learning how to manage so that we never get to the line of, oh, now we need all the medications that cause more complications, so on and so forth. And it's just a really cool thing for people just to experiment with themselves, right? So there's a lot of different factors that, we can talk about. Maybe let's talk about now. What are some of the factors that influence blood sugar going up?
So there's a lot of different factors that people don't think about. Food is the most obvious. Carbohydrates, sugar, mostly the processed foods versus those unprocessed whole foods. Having a bowl of cereal versus some scrambled eggs with some veggies in there. Those are going to be different blood sugar spikes versus, other things. So trying to have more whole foods is going to regulate that blood sugar much better. Our body's always going to have some kind of blood sugar response, but the goal is to not have it go up so high and stay up for a very long time. We want it to go up a little bit and then come back down and be controlled. So food is definitely one of them. Like I mentioned earlier, medications, steroids in particular will make the blood sugar go up. At our hospital, we have a lot of cancer patients, and a lot of them not diabetics, but they're on steroids to fight infection. And they're coming to us saying, why am I on a diabetic diet? Why are my blood sugar so high? Well, in all reality, it's because of some of those medications that they're consuming. Again, illness, sickness, any type of bacterial or viral infection can cause blood sugar to go up. Your body is in that fight or flight mode, and it's really trying to expel more energy, so that glucose, to help fight off those infections, and really your immune system's in overdrive. The same thing with the other factor that can help, or that actually makes your blood sugar go up, is the stress. People do not know about this one. And at HSN, we really, really focus on stress management, because I swear, since COVID, stress management is a really big topic, because a lot of people are so stressed. Again, similar situation to the illness. Your body is in that fight or flight mode, expending more energy to keep you, quote unquote, safe. So your blood sugar might go up. And this is the really cool thing about the CGM. You're able to see this in real time. You know, for example, you're going through your normal day, you have your CGM, you're looking at your numbers, you've been able to obtain good habits that have led to your blood sugar staying balanced, and then all of a sudden at 2 o'clock, 3 o'clock, something stressful comes up. More paperwork comes across the desk, someone's calling you to pick up a kid that's sick, whatever the case may be, and your stress starts to increase, and that actually is going to correlate with an increase in blood sugar going up. So it's amazing how many different factors that increase your blood sugar. Also, another one that is a little bit interesting is the alcohol. So alcohol, whenever you consume alcohol, your liver processes alcohol, but your liver also is what produces glucose. So this one's kind of a weird one. As you've consumed that alcohol, your liver is processing the alcohol. It takes a few hours. Your body is not producing that blood sugar, so you might actually get a low blood sugar. But over a few more hours after you're done consuming the alcohol, your liver's trying to catch up. So you might have gone into a low blood sugar, but then eventually you get a high blood sugar from that alcohol intake. So there are so many different factors. Another one is sleep. If you're not getting enough sleep, then that can increase, your insulin resistance. Nicole, I know you've talked about this on another podcast. I can't remember exactly, but maybe four nights of less than 6 hours of sleep will increase your insulin resistance. That is just mind blowing, because so many people go 4 hours, 5 hours of sleep a night, and we really encourage that 7+ hours, 7 to 8 hour window of sleep. And so again, just coming back to our HSN framework, it's literally hitting all of the different points. So the Signos CGM and paired with the nutrition coaching is so vital, because we're able to integrate all of that into it and really help with reducing those factors, figuring out what factors that increase your blood sugar can help stabilize your blood sugar.
Yeah, you're right. There's so many different factors, right? You touched on food, you touched on alcohol, you touched on lifestyle, you touched on sleep, stress, like all of these factors. And when you look at the HSN wheel, like we are addressing all of those things when we're working with clients. I think when we talk about the food specifically, and we talk about diabetes management, blood sugar management, what you can see when you do the CGM, what we're talking about with clients isn't following a super restrictive diet or following a specific macros. It's starting off with the first, like the core principles of Healthy Steps Nutrition. Eat whole foods first. Eat more vegetables. Load up with that first. Have your protein. Make sure that you have protein. Have some healthy fat. Have a little bit of starch, but let's not go overboard. Focusing on balance, pairing protein, carbs, and fats together. You literally see a difference in your blood sugar when you pair these things together. And then the third thing, the third core principle is limiting the amount of processed, ultra processed food and added sugar that we consume, which ultimately is one of the leading causes of chronic disease today. And what's super interesting with this CGM is a couple of things. Number one, the way I respond to food is going to be slightly different than the way you respond, Brittany, right? Like,
Yep.
if we're both eating, I don't know, an acai bowl, for instance, is going to spike up our blood sugar because it has so much added sugar in it. My blood sugar might spike up faster and higher and take longer to go back down than yours, right? So people's insulin sensitivity or, glucose sensitivity is different. And I think it's important for people to understand, to take control of your own health so that you can prevent and reverse chronic disease, to know what's going on the inside of your body. So, I think that's a piece of the puzzle that's super interesting when you look at adding CGM and then the real-time feedback loop. So sometimes you might not know, hey, why is this happening? What's going on? And it's not necessarily related to the food. Like you had talked about, a stressful conversation or something happens with getting a kid or whatever the case may be, your blood sugar might go up a little bit. And the other piece is the sleep part. I noticed for me, when I had some glasses of wine at night. Let's say we did it during the holidays. So we were at families' houses and, having 2 glasses of wine at night, I could see a significant difference in my blood sugar being elevated all night long, which related to the quality of sleep that I had, which related to how I felt the next morning. And I think sometimes we get distracted and we say yes to what we want now, when in reality, we really need to be saying yes to what we want most, which hopefully is in line with taking control of our health, preventing and reversing chronic disease. Yeah, you might have like a weight loss goal, and this definitely will help you stay on track. I think you've worked with a majority of people going through this continuous glucose program, and I think we should spend a few minutes talking about it. But what I've seen, and I've actually targeted some of our clients, like, hey, you're doing so good during the week, and I know we're struggling staying on track on the weekend. But if you had an instant feedback loop, if you could see exactly what's going on, the cool thing with the Signos dashboard for us and for our clients is we can see what is the percentage of time during the day that your blood sugar is in range versus out of range. And I can tell you dozens of clients that went from less than 30% of in range to, by the end of the time working on CGM with our nutrition coaches, went to above 80% in range. Like, that is preventing and reversing chronic disease. Because ultimately, if you're in range less than 30% of the time, you are on a track of going and getting diabetes, which when we look up the stats, I pulled some numbers. Let me grab them. Over $16,700, the average medical cost for a person with diabetes, over $16,000 annually. And directly attributed to diabetes is over $9,601. The person who has diabetes, 2.3 times higher medical costs than someone without diabetes. So it's either, understand your body now, take the education, the knowledge to make the changes, to make the healthy lifestyle, or you're going to, unfortunately, if you look at the stats, you likely will pay for it later.
Right. And I'm thinking about a client in particular, healthy, naked eye, exercises, eats well, knew that they had diabetes in their family. Their mother had diabetes. They wanted to take control of their health and prevent that chronic disease that they already knew was part of their genetics, right? So we did the CGM together. And I believe whenever we started out, they were in that 60 to 70% range within the first week. And by making simple changes, one habit at a time, we were changing how much vegetables they're eating, when they're eating protein, which food groups they were pairing together. By the end of the 4 weeks, 95% of the time they were within range. And on top of that, they were trying to lose 3 to 5 pounds that they had been trying to lose for such a long time, and they were able to lose it very easily. And there's also that metabolic factor that comes into play, going back to the stress. We know that increased cortisol, that's where that belly fat comes from. So that has a correlation with your blood sugar, that stress in your blood sugar. So even from a very simple, fundamental nutrition standpoint, making sure that you're eating at good times, you're eating consistently throughout the day. You're making sure that you are pairing the right foods together. We're not eating too late during the day, nutrient timing with our workouts, those all go into play. So I think whenever my clients do use the CGM, their eyes become open to, oh, I didn't realize if I ate, an hour before I go to bed, how that not only affects my blood sugar, but how it affects my sleep.
Right.
So there's just so many different aspects and different benefits for using the CGM to understand. And the same thing, like you said, Nicole, is, we could go and have, say, Chipotle, a bowl of, salad, make your own. You could have one, I could have one, and we could literally make the same exact bowl and we would have different results for our blood sugar. So I think it's so interesting to be able to have that instant feedback and make changes based off of that. Because typically, if we're just working with a nutrition client one on one, we're not able to see those specific numbers. And the other cool thing is, again, we do not have to count calories, we don't have to count macros to make these changes and see these changes.
Absolutely. I think what's really interesting and what was eye-opening for a lot of the clients that I worked with in this doing CGM is they didn't realize, like, foods that they thought were going to be really good, really healthy. They went out to eat, they picked a good choice, and then their blood sugar would skyrocket. And they're like, Nicole, what is going on? Why did this happen? I ate XYZ. Why is my blood sugar spiking? And then when we dug a little bit deeper, it's like, oh, the sauce in there and the breading in this and all of these different things that end up having sugar in them, because companies know when we add sugar to things, it's tastes better. We crave it more, which will make us want to come back to that restaurant or eat that food again. So it's just super interesting to see what is exactly going on. And I saw a lot of clients end up cutting down the amount of alcohol that they consumed because of this, strictly because they realized, man, when they started like with the Whoop or, one of the rings or whatever, tracking their sleep, they realized, holy cow, when I drink, my blood sugar is elevated, my sleep is not good, and then I'm not waking up as my best self the next day. So I think it's a really good experiment that, I would recommend, hey, do it for a month and just see what's going on the inside of your body. I think so many times we just wait until something's broken versus like, hey, we look at the sickness, wellness, fitness continuum that CrossFit, that Greg Glassman made years and years ago. Like, why are we waiting until we get to the sickness side to understand how to get to the fitness side? It does not make sense to me.
Yeah. It's funny. A lot of people will say, if it's broke, don't fix it. But we can still work on it. We can still work to further ourselves, become our best selves, even though it's not quote unquote broken. What if you are one of those people that are borderline pre-diabetic or pre-diabetic? Well, maybe it's not quote unquote broke, but you can make it better, because the more that you fall into that sickness category, moving towards that spectrum of diabetes, the harder it is to get out of it. So learning these good habits now just instills that sustainability for those habits long term. It's very similar to when people started smoking. They didn't realize it was a big deal, but it took years off of their life. Same thing with diabetes. It takes years off of your life. Having elevated blood sugar, even just as someone without diabetes, having elevated blood sugar has an effect on your kidneys. It has an effect on your heart, your blood circulation, back to the, vascular issues with amputation and blood clots, things like that. So you do really need to pay attention to this, even if you don't have diabetes in your family.
And when you look at the stats, 50% of the US population has diabetes or prediabetes. 1 in 3 people have prediabetes, and 80% of those people do not know. That is the mind-blowing statistic. Like a third of people that are listening to this podcast, maybe not this specific podcast, because I feel like this podcast attracts attracts people that care about their health. Hopefully more people do. But 80% of that third of the population do not know. So I want to shift gears and talk for a couple minutes about the CGM program that we have. Now, there's a lot of different CGMs out there. To my knowledge, HSN is the only program that has paired continuous glucose monitoring with registered dietitian instant feedback results and using that holistic and habit-based approach. To my knowledge, we're the only program out here that is doing it. So what it looks like is we recommend doing a month. So it starts, you essentially purchase, it's a 3-month program that you're working with our dietitians, but 1 month you're going to do that CGM. And it's, like you said, a little, it's not even a punch. Like it's like a stamp,
like
I guess. A little stamp, nothing crazy, does not hurt. I am one of those that are scared of needles, does not hurt. So what it looks like is you end up getting a medical form. Brittany, you are actually going to do it and you're going to share on your social media what's going on. You just filled out this medical form 30 minutes ago and super easy, quick questions. They're just making sure that you don't have diabetes, because the way insurance works, the way our broken healthcare system works, to pay out of pocket for these CGMs, you essentially cannot be diagnosed with prediabetes or diabetes. It has to go through insurance or another path for that. So Signos has the market on being able to do this if you don't have prediabetes or diabetes. So you essentially fill out the form, you end up getting the box shipped to you. And from there, you're working directly with a dietitian. So from a dietitian on our staff, you're going to do that initial consultation. You're going to have weekly calls to review what's going on. The dietitian is going to send you messages at the end of every week to check in. We can see in real time what's going on with your blood sugar. You can take photos of your food and we can see in real time what's going on. And that is the beauty of it, because you take all the guesswork and trying to figure out what these numbers mean and create with an expert how to prevent and reverse chronic disease in your specific case. Hey, we're noticing this. This is what we want to do. Let's stay consistent here and let's see what happens. It's just an experiment. I think, big picture, what people have realized is, number one, going out to eat, realizing like, what are some places that I can really stay on track with my blood sugar and still eat foods that I really love. Pairing foods together, portion sizes. One simple tip that I actually recommend for every single person is going for a 15-minute walk after meals. It will significantly lower your blood sugar. It helps with digestion. It helps with mood, energy levels. There are so many benefits. If you're listening to this and you're like, I don't know about CGM yet, do that one thing. Kayla, one of our other dietitians on our team, was talking yesterday on our team meeting, and she was like, I ate the same exact thing. And I went for a walk and I didn't go for a walk. Same portion, same everything. My blood sugar was significantly lower after going for a walk. Like, that is a simple task that every single person can do after meals.
Yeah, so easy and so actionable to start today.
Right. So you have weekly calls with the dietitian during that time that you're doing the continuous glucose monitoring. You can stay with the weekly calls. We call that the higher accountability program, or you can transition to a little bit lower accountability where you're either coming in person once a month or having a little bit shorter calls every other week. But I truly believe that if people understood what's going on the inside of their body, they would be more likely to stay consistent with the changes that they need to make and create those habits to ultimately create the lifestyle they want to become the healthiest version of themselves.
Yes, absolutely. Absolutely. And, I did the CGM 2 years ago, and I'm really excited to do it now. Talking with Kayla, talking with yourself, I have some experiments in mind. So definitely follow along on my journey. I'm going to try some different foods, pairing the alcohol, seeing those effects, pairing the exercise, seeing those effects, sleep as well. I'm going to just continue to live my life my normal way and see what additional changes I can make, as a dietitian myself, trying to continue to better myself and then also help our clients further with the CGM. So we're really excited about this project program. It is so beneficial. And again, just continuing to prevent chronic disease is our utmost goal.
Awesome. Well, Brittany, thank you for all that you do. We will put in the show notes the link to your social media so that people can follow you. Maybe we'll just have you collaborate with the fitness dietitians, or maybe just post directly on there too, so people can follow along on that channel. I think ultimately, we need to educate ourselves on what's going on the inside of our body and not wait for the broken healthcare system to give us another Band-Aid and ultimately not actually fix the root cause. Medications are not going to fix the root cause of unhealthy habits that are leading to the chronic disease that's plaguing so many people today.
Yes, absolutely.
All right. Awesome. Brittany, thank you for all that you do. And I'm excited for you to continue to work with more people on CGM.
Yeah, absolutely. Thanks, Nicole.
I hope you enjoyed that episode with Brittany and understanding a little bit more about continuous glucose monitoring and how it might help you understand what's going on the inside of your body and get a deeper knowledge of nutrition, food, and what's best for you. If you want to follow along on Brittany's continuous glucose monitoring experiment over the next 30 days, make sure that you click the link in the show notes to find her social media account. I'm sure she would be open and love for you to follow along and ask any questions along the way. Big picture with continuous glucose monitoring and just managing your blood sugar in general so that you can prevent and reverse chronic disease like diabetes and prediabetes is focusing on whole foods first, focusing on balance, pairing protein, carbs, and fats together. It helps to stabilize our blood sugar, helps keep us full longer. We want to follow something as simple as the plate method. Half of our plate non-starchy vegetables, quarter protein, quarter starch. Another practical tip would be, and we've mentioned this a couple times, go for a 15-minute walk after meals. Helps with digestion, helps stabilize your blood sugar, also with energy levels and mood. Try it out. See how you feel. Hope you enjoyed this podcast episode. Don't forget to subscribe. Leave us a review. It really helps this podcast reach more people. Make sure that you stay tuned for next week.